Hi, friends. Charlie here. I want to talk about an exciting topic that is really taking over both the digital health space, healthcare, as well as Wall Street, and that's the exciting developments in the use of psychedelics for mental health treatment. I think in the last 90 days, we've seen three companies go public, and they're almost viewed, well, they are viewed as, therapeutic biotech companies. Um, and the revolution in the science has actually been around for a while. I guess you call it a revolution, that it's more a revolution of adoption and acceptance than it is about some type of breakthrough. Just a little history of the psychedelic movement. It really starts, I think, with Johns Hopkins has a school for psychedelic studies and have been working for almost 10 years now on studies that associate with post-traumatic stress disorder using psychedelics and guided therapies. So keep in mind, this is at this stage is not we're not talking about just handing somebody a tab of acid and saying good luck with that all that. This is using certain dosages, low dosages that are then paired with therapy, so guided meditation and or guided therapy. So the psychedelics, and this we're talking about psilocybin, MDMA, which is ecstasy. Um, there's a few other ones, but essentially, the science is amazing. I mean, it's just basically if you combine, getting a therapist to key in on some trauma, i.e., with vets and post-traumatic stress, the psychedelics allow the brain to kind of gain a perspective, and there's almost a rewiring of the neurons with that trauma. Um, and it is just a kind of a doorway. It's a rewiring process that is dramatic. It is literally like rewiring a computer with natural compounds. So that's what's incredible. And at Johns Hopkins, they did a 5-year study with post-traumatic stress disorder. We're talking 3 sessions, guided trip sessions with therapists. And after 5 years, something like 75% of the participants had no indications of post-traumatic stress, had no issues with depression. It was just, it's unbelievable. So that's kind of started the whole revolution. And, now these psychedelic compounds are being experimented with, whether they're, actually making artificial compounds at Compass Pathways in England, or, just experimenting with magic mushrooms, with therapy. So, where does this all sit with cancer patients and my company, and what's our vision? What's our kind of stance on this whole thing? And I think I will say it right now. I think we, as a company and as uh, patients, who are dealing with end of life, we should be at the forefront of both either partnering with companies who are trying to develop these therapies from a clinical trial perspective, um, or having our own sort of services associated with end of life palliative care hospice. I mean, I think going forward, I'm talking about, 12 to 24 months from now, our movement is going to be into end of life care. And I think what needs to be done and how I see it evolving is it's a process, it's a preparation, and these types of therapies have shown to lower anxiety, give great perspective, and I can't, I believe it's going to be big. I think it's going to be a standard of care for hospice treatment probably in the next, 3 to 5 years. Um, I want to tell two stories associated with cancer patients and psychedelics. One is a woman who had pancreatic cancer, diagnosed pancreatic cancer twice. I mean, and still living today. She was part of the Johns Hopkins study, and she and I spoke at length about her experience, and she said that the experience completely rewired her brain, that she felt less fear about death than she ever had. She told me just jokingly, she said, honestly, every day I wake up and I look myself in the mirror and say, one day you're going to die, but not today. And for someone that has, faced such a horrible diagnosis, I mean, that's magical to me. Number two is an even more personal story about a friend of mine that I was introduced to, I want to say 7 years ago. His name was Dan. And Dan had childhood brain cancer around, I want to say when he was 10 to 12 years old. And through the treatments, 2 years of treatments, 2 years of surgeries, it left him really kind of, sort of limited in his intellectual capacity, so to speak. And years later, almost 20 years later, he got re-diagnosed with the same cancer. The cancer had come back, and that's when I was introduced to him, and we spent a lot of time together. It was very clear to me that a lot of his friends pulled back after this diagnosis, kind of like, it was almost like they had decided he was already going to die and they didn't want to deal. So I spent a lot of time with him. In fact, I used to go down and hang out with him every Wednesday when I was headed down to the city for therapy. I used to sit with him from 4 to 5 p.m. almost every Wednesday just to talk. I mean, just he needed a friend, and we spent a lot of time. And one of the saddest moments for him was when he told me, I'm really depressed. And I said, why? He goes, because they told me the tumor is shrinking. And I said, oh my God, Dan, like, what do you mean? He's like, I'm just done. I feel like I have no life. I feel like I'm lonely. I feel like I don't want to live like this anymore. And he was really in a dark place. His parents were well aware of his emotional status, and I tried to really respect him as a person and wishes, and just tried to listen and be supportive. A few weeks later, I actually took him down to my mother's beach house for the weekend, and we did a mushroom trip together. I'd known that this had shown evidence of improving mental outlook, and he was all for it. And I can tell you, you know after that experience, his whole mood changed. I mean, it was dramatic. His parents say, Charlie, like, what did you do over the weekend? And I'm like, well, we just talked a lot. That's all I could kind of disclose. But um, it was at that moment where I realized there was something to this, and that's actually what started me on my education of psilocybin and the work with Dr. Paul Stamets out in his facility, his research institute out in the Northwest. So unfortunately, about 6 months after that experience, Dan committed suicide. He had fallen back in, and everyone had done everything we could to sort of try to convince him otherwise. But that was his choice, and I'm certainly not condoning suicide as a method for folks. But I can understand. I mean, all I can say is I can understand when I've said this before in my previous post about symptom management, quality of life, and depression. It's like when you have no quality of life and you have no function, you lose meaning and you fall into depression, and that can lead to a place of frankly giving up. So the bottom line from my perspective and my company's perspective is we are 1000% supportive of the use of psychedelics for end of life cancer treatment. I want to lead in this area, and I'll say it to any psychedelic research companies that are involved who want to get in the cancer space. We are open for business to try to partner up with you guys to both find patients and run studies. And I've got some amazing contacts in the space, and it's something that I can see, like I said, in 5 years, where part of the service offering is, in some type of hospice end of life care would be the use of guided, psychedelic therapy. So that's my take on it. Wishing you all the best, and take care.